How to pass phlebotomy exam. Question 1. Which of the following is a common site for capillary puncture in adults? Option A, ring or middle finger. Option B, thumb. Option C, palm. Option D, dorsum of hand. The correct answer is option A, ring or middle finger. The ring or middle finger, lateral aspects of the third or fourth digit, are standard capillary puncture sites in adults. The thumb is avoided due to its pulse, the index finger is often calloused, and the pinky is too small. The palm and dorsal hand are not standard capillary sites. Question 2. Hemolysis in a blood sample is most often caused by option A, proper tube mixing. Option B, using a large gauge needle. Option C, excessive force during collection. Option D, inverting tubes 8 to 10 times. The correct answer is option C, excessive force during collection. Excessive force when aspirating blood through a syringe or expelling it into a tube causes turbulent flow that ruptures red blood cell membranes, resulting in hemolysis. Using a large bore needle actually reduces hemolysis risk by minimizing shear stress on cells. Question 3. Which action is required after a phlebotomy procedure? Option A, leave patient without instructions. Option B, instruct patient to flex arm vigorously. Option C, apply pressure and bandage. Option D, ask them to shake hand. The correct answer is option C, apply pressure and bandage. After needle removal, firm pressure must be applied to the puncture site for several minutes, followed by a clean bandage, to achieve hemostasis and prevent hematoma formation. Patients should be instructed to keep the bandage on and avoid heavy lifting, not to flex or shake the arm. Question 4. What is the purpose of antiseptic in phlebotomy? Option A, stop bleeding. Option B, prevent infection. Option C, mix sample. Option D, stimulate vein. The correct answer is option B, prevent infection. Antiseptics reduce the microbial burden on the skin surface prior to needle insertion, preventing introduction of bacteria into the bloodstream, bacteremia, or contamination of the specimen. They must be allowed to dry completely before puncture for full efficacy. Question 5. Capillary draws are preferred when? Option A, patient is dehydrated. Option B, patient is elderly only. Option C, patient is neonate or with fragile veins. Option D, coagulation studies. The correct answer is option C, patient is neonate or with fragile veins. Capillary puncture is preferred for neonates, infants, and patients with small or fragile veins where venipuncture would be traumatic or difficult. Dehydrated patients actually present more venipuncture challenges, and coagulation studies require adequate venous volumes. Question 6. A patient with known fainting history should be: Option A, placed in supine position. Option B, allowed to stand. Option C, told to flex arm. Option D, asked to walk around. The correct answer is option A, placed in supine position. Patients with a history of syncope should be placed supine, lying flat, before venipuncture to prevent falls and injury if vasovagal response occurs. This is a proactive safety measure that does not require waiting for symptoms to appear. Question 7. The antiseptic used for blood culture site preparation is: Option A, alcohol only. Option B, iodine or chlorhexidine. Option C, saline. Option D, hydrogen peroxide. The correct answer is option B, iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 8. Which is the best action if patient complains of pain? Option A, continue immediately. Option B, pause and check technique. Option C, apply more pressure. Option D, ignore complaint. The correct answer is option B, pause and check technique. Patient complaints of pain during venipuncture should prompt the phlebotomist to pause and assess for needle misplacement, nerve proximity, or vein damage. Continuing without evaluation risks nerve injury. Ignoring complaints violates patient rights and professional standards. Question 9. Reflux of anticoagulant into a patient's vein may cause: Option A, hematoma. Option B, infection. Option C, tissue necrosis. Option D, vision loss. The correct answer is option A, hematoma. Anticoagulant reflux can cause adverse reactions including hematoma formation and, in rare cases, systemic complications. To prevent reflux, the patient's arm should be kept in a downward position and tubes should be filled from the bottom up during collection. Question 10. Which of the following terms refers to the study of blood? Option A, hematology. Option B, microbiology. Option C, immunology. Option D, radiology. The correct answer is option A, hematology. Hematology is the branch of medicine and laboratory science dedicated to the study of blood, blood-forming tissues, and blood disorders. Microbiology pertains to microorganisms, while immunology focuses on the immune system. Question 11. What is CLIA? Option A hospital association. Option B, regulatory standards for lab testing. Option C, a nursing credential. Option D, a phlebotomy technique. The correct answer is option B, regulatory standards for lab testing. CLIA, Clinical Laboratory Improvement Amendments, establishes federal regulatory standards for all clinical laboratory testing performed on human specimens to ensure accuracy, reliability, and timeliness of results. All labs performing patient testing must meet CLIA requirements. Question 12. A phlebotomist notices petechiae on a patient's arm. This may indicate: option A, abnormal finding. Option B, fragile capillaries or platelet disorder. Option C, allergic reaction to tourniquet. Option D, dehydration. The correct answer is option B, fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 13. The term phlebotomy literally means: option A, vein incision. Option B, artery puncture. Option C, skin puncture. Option D, blood transfusion. The correct answer is option A, vein incision. Phlebotomy derives from the Greek phlebo, vein, and tomi, incision or cutting, literally meaning the incision of a vein. While modern phlebotomy uses needles rather than actual incision, the term remains the standard descriptor for blood collection procedures. Question 14. The anticoagulant in a lavender top tube is: option A, heparin. Option B, DDTA. Option C, citrate. Option D, goxalate. The correct answer is option B, EDTA. Lavender top tubes contain EDTA, ethylenediamine tetracetic acid, which chelates calcium to prevent clotting and preserves cellular morphology, making it the standard tube for complete blood count, CBC, and blood smear preparation. Heparin is found in green top tubes. Question 15. Failure to invert a tube containing an anticoagulant will result in: option A, clotting. Option B, hemolysis. Option C, lipemia. Option D, elevated glucose. The correct answer is option A, clotting. Anticoagulant tubes must be inverted immediately after collection to ensure the additive mixes thoroughly with the blood sample. Without adequate mixing, fibrin clots form within the specimen, rendering it unsuitable for analysis and requiring recollection. Question 16. Labeling specimens should be done: option A, before collection. Option B, while patient waits in reception. Option C, at the patient's side after collection. Option D, at the end of the day. The correct answer is option C, at the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection, while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 17. For proper specimen identification, labels should include: option A, patient name, ID number, date/time. Option B, only patient name. Option C, only date. Option D, only test type. The correct answer is option A, patient name, ID number, date/time. Complete specimen labeling requires at minimum the patient's full name, unique identifier, medical record number or DOB, date and time of collection, and collector initials. Incomplete labeling is a critical error that can result in specimen rejection or patient misidentification. Question 18. For a 2-year-old child, the best collection site is Option A, heel or finger, Option B, ankle vein, Option C, femoral artery, Option D, basilic vein. The correct answer is Option A, heel or finger. Capillary puncture from the heel or finger, lateral fingertip, is preferred for young children when small volumes suffice, as it is less traumatic and safer than venipuncture. Femoral and basilic sites carry higher complication risks and are not routine pediatric choices. Question 19. A patient with edema may present difficulty for Option A, capillary puncture, Option B, venipuncture, Option C, urine collection, Option D, arterial puncture. The correct answer is Option B, venipuncture. Edema, fluid accumulation in tissues, obscures veins and makes palpation and visualization difficult, complicating venipuncture. Edematous tissue also dilutes specimens with interstitial fluid. Alternate sites or capillary collection may be required. Question 20. Airborne pathogens require what level of precaution? Option A, contact. Option B, droplet. Option C, airborne isolation. Option D, standard only. The correct answer is Option C, airborne isolation. Airborne isolation precautions are required for pathogens like Mycobacterium tuberculosis, measles, and varicella that are transmitted via small particle aerosols. This requires N95 respirators and negative pressure isolation rooms, a higher level than droplet or standard precautions.